the largest physician-led organization in the United States addressing the health risks and threats to human survival posed by nuclear weapons, climate change, nuclear reactors, and toxic degradation of the environment. Thank you for coming this morning. On April 26, 1986, the fourth reactor of the Chernobyl nuclear complex exploded, contaminating approximately 77,000 square miles of land and spreading dangerous radioactive isotopes around the world. On March 11, 2011, another terrible series of nuclear reactor accidents occurred at the Fukushima Daiichi complex in Japan. Although one disaster occurred 25 years ago and one just 6 weeks ago, they both are International Nuclear Events Scale Level 7, the highest, nuclear accidents, in which there are, quote, major releases of radioactive material with widespread health and environmental effects requiring implementation of planned and extended countermeasures, unquote. As you will now hear from our series of speakers, both catastrophic accidents have already caused serious adverse human health consequences and will have unknown but likely very serious human health, environmental, and economic consequences for many years to come. As part of today's presentation, we will also be sharing a new interactive mapping tool that allows one to determine exactly how close one is in relation to a U.S. nuclear reactor and its evacuation zone. How many people are also in that particular evacuation zone and at risk, and other pertinent information about each reactor. Also available, and it was at the front desk, is a briefing packet that's been printed out for you with extensive background information on radiation and health relative to the Fukushima and Chernobyl disasters. The briefing book and the interactive map are also, as we speak, going live, and I think are live, on the PSR website, which you can access by www.psr.org. So I'm now briefly going to introduce each of our four presenters who will speak in turn. Please hold your questions until after the four presentations, which will take about 5 minutes each. And when you have a question, please go to the microphone to ask it so that you'll be recorded both by the media and recording that we're doing. So speaking first, and to my far right, is Dr. Jeff Patterson, PSR's immediate past president. Dr. Patterson is a professor in the Department of Family Medicine at the University of Wisconsin School of Medicine and Public Health. Dr. Patterson has visited Chernobyl and sites of nuclear testing and nuclear weapons production in the former Soviet Union and is an expert on the medical effects of radiation. Speaking second, and to my immediate right, is Robert Alvarez, senior scholar and at the Institute for Policy Studies here in Washington. Robert Alvarez's work currently focuses on nuclear technology and disarmament, environmental and energy policies. Between 1993 and 1999, Mr. Alvarez served as senior policy advisor to the Secretary and Deputy Assistant Secretary for National Security and the Environment at the Department of Energy. To my left and speaking third will be Dr. Andrew Kanter, President-elect of Physicians for Social Responsibility. Dr. Kanter is an internist and assistant professor of clinical biomedical informatics and clinical epidemiology at Columbia University. He has been educating about nuclear power since 1982 and has studied the medical and public health consequences of nuclear reactor accidents on large metropolitan areas. And finally, speaking fourth, to my far left, is Dr. Ira Helfand, past president of Physicians for Social Responsibility. Dr. Helfand is a board-certified internist in Springfield, Massachusetts. He has lectured and published widely on the medical consequences of both nuclear weapons and nuclear power since 1979. Jeff?
Thank you very much, and welcome. It's a pleasure to be here on a beautiful day in Washington. We're really here to mark the 25th anniversary of the Chernobyl nuclear power plant disaster, but to honor those who gave their lives in saving the world by covering up that plant with sand, boron, and concrete. And many of them died at the time, and many more have probably died since. This is particularly important since we are currently experiencing another similar accident in Fukushima, which is frighteningly similar in scope and in quality. Chernobyl experiment has been a continuing disaster from the moment the engineers started it. The impacts go far beyond simple cancer deaths, which were the most frequent thing that we talk about, and include severe physical, social, and economic damage, which will continue for many years to come. The studies of the effects of Hiroshima and Nagasaki bombings are not yet complete 65 years after the bombing, and that was a simple one-time dose of radiation. This situation is much more complex. Chernobyl has resulted in severe economic hardship, largely borne by the Ukraine, Belarus, and Russia. The Ukraine and Belarus now spend between 5 and 7% of their national budgets on Chernobyl results. The Ukraine early on spent a sixth of their national budget on the Chernobyl situation. And in 1991, Belarus spent 22% of its national budget on Chernobyl. Imagine if that were the situation in the United States. The Tea Partiers would probably have a heyday with that. Now a new sarcophagus is being built over the old sarcophagus, which was built to last for 10 years, and we're now 25 years down the road, with an estimated cost of $100 billion. And the Ukrainian government is begging for more money because they can only raise $850 million for this. The project's already 3 years behind schedule. Will it ever get built? And what's going to happen 100 years from now when that sarcophagus is no longer intact? The social and psychological costs are likewise difficult to quantify. What are the effects of relocating 350,000 people who were evacuated and resettled from the Ukraine-Belarus area between 1986 and 2000? These effects really cannot be quantified in any meaningful sense. What is the long-term effect on the ecosystems of 77,000 square miles of land that were heavily contaminated and the 2,000 square miles of territory adjacent to the reactor that have been declared uninhabitable? Perhaps for hundreds of years. Recent reports show that the cesium levels around the plant in the uninhabitable zone have not declined as we anticipated that they would. And we don't know why this is. Again, the unknowns far exceed the knowns with these accidents. And finally, what are the health effects? Well, there is a huge difference in the numbers which are given from different groups as summarized in our report. These differences are hardly unexpected given the history of the nuclear industry, which is that of secrecy, minimization, and cover-up. This is exemplified by memos from the Soviet Union after Chernobyl, which stated, quote, "The presence of acute somatic illness and activation of chronic disease in persons who were involved and who do not have acute radiation syndrome, the effect of ionizing radiation should not be included as a causal relationship." The records, health records of how much radiation many of the liquidators received have simply disappeared. We have no way to follow up what happened to these people. I spoke recently with one of the head liquidators whose job was to measure high levels of radiation around the plant to tell workers they could go here for 10 minutes or 15 minutes. And I asked him at the end of our conversation, I said, "How much radiation did you get?" And he said, "I have no idea." In the United States, we've noticed the same indifference to public health with nuclear testing when the Department of Defense would notify the Kodak Corporation of nuclear weapons going off, and yet didn't bother to tell the public the fact that there was radioactive iodine in your milk, cesium from the nuclear weapons tests as it swept across the United States. And of course, this is continuing in Fukushima today as we're now seeing reports of increased levels of radiation released from the plant, different from what they originally told us. And a report recently of the 50 workers, the Fukushima workers, which is actually several hundred workers, complaining that their radiation dose levels are not being accurately recorded. Well, scientific arguments regarding the health effects of particular doses of radiation will and should continue. However, to make this the focus of any discussions of nuclear safety really obscures the real issue, thus missing the forest for the trees. The real issue is that the use of nuclear power and nuclear weapons is forcing humankind, and indeed our whole ecosystem, to participate in a particularly cruel and totally uncontrolled experiment. Given the scientific evidence that there is no safe dose of radiation, this is an experiment that has already gone awry. Indeed, if it were a true scientific experiment, it would have been halted a long time ago. The real question is whether we as a human race can afford in good conscience to risk annihilation with our continued reliance upon nuclear technology. Can we continue to despoil our environment with long-lived radionuclides, materials that are scattered to the wind and embedded in our precious soil, randomly exposing large populations who are unconsenting, unknowing, and fostering health impacts on unsuspecting future generations who have no choice in this matter? We may choose to do so for a variety of reasons, but if we do, I am quite sure that our children, grandchildren, will roundly condemn us for our lack of foresight and selfishness. As they struggle to deal with the poisonous environment that they inherit and the waste that must be safeguarded for thousands of years, they will certainly wonder what possessed us to do this. Thank you.
Good morning. Thank you for allowing me to speak. The Chernobyl accident had a very interesting impact in terms of its aftermath on the United States. It, I think, largely went unappreciated because it didn't really impact all that much our commercial nuclear power program, but rather it had a very profound impact on the U.S. nuclear weapons production complex. Because what the Chernobyl accident did is that it turned the spotlight onto the fact that the Russian nuclear program and their nuclear weapons program bore some disturbing similarities to that of the U.S. Department of Energy nuclear weapons program. Immediately after the Chernobyl accident, the public became aware that the Department of Energy was operating several reactors of the 1950s era that had no containment domes. And for the first time, there was some truly independent environment safety and health investigations of the Energy Department and its practices, which revealed a rather disturbing picture that we're now coming to terms with, is that we've created large, profoundly contaminated areas. Hanford site in eastern Washington is considered one of the most contaminated zones in the Western Hemisphere. The notion of having national sacrifice zones have now become a reality as a result of the nuclear weapons program. At Hanford, somewhere on the order of 700 metric tons of plutonium were disposed directly into the ground. The Energy Department is now calculating that in less than 1,000 years that plutonium might migrate to the near shore of the Columbia and render the near shore uninhabitable in less than 1,000 years. Chernobyl, quite frankly, accelerated the shutdown and the collapse of the U.S. nuclear weapons production complex even before the end of the Cold War. And I think that's an untold story, but I'm not here to sort of lay out all those details, but rather to focus a little bit more on the Fukushima accident and what it means for the commercial nuclear power program of the United States. I think that there are some very big lessons now that we have to learn about the Fukushima accident with respect to nuclear power in the United States. And the one thing that I have worked on for several years is the problem of stored spent fuel in the United States. We have approximately 65,000 metric tons of spent fuel that's been generated, I think, roughly at the end of last year. Approximately 75% of that is stored in pools that were never designed to hold this much. The pools are holding on the average of 4 to 5 times more than their original designs intended. They were meant to be temporary storage facilities to allow the spent fuel to cool off, to be sent elsewhere, initially to a reprocessing plant, which is not happening in this country, and then subsequently to a high-level nuclear waste repository, which has also become more of an illusion now that the Yucca Mountain project has been canceled by President Obama. These pools, as some of you may know, are not nuclear safety rated items at reactors. Unlike the reactors themselves, the pressure vessels, which have these thick concrete and steel shielding around them to prevent the escape of radioactivity in the case of a major accident, the pools do not have that. The pools are essentially covered in buildings that are designed to protect them from the elements. Buildings that some people call Butler buildings in the United States. And if you take a look at the damage photos of Fukushima, you see that at least the 2 hydrogen explosions at units 3 and 4 show that the pools were exposed to the open sky. The bridges that the crane bridges that were moving spent fuel to and from the pools collapsed onto the pools. The pools were elevated about 80 feet above the ground. At least one pool, part of one pool, I believe, probably the upper pool, the staging pool, experienced some sort of event where the water was lost, and whatever the contents were in the pool at that time led to a very destructive hydrogen explosion and probably the release of a large amount of radionuclides. We have about 31 reactors in the United States of the boiling water Mark I, Mark II designs that have this similar design characteristic of elevated pools, and they are quite full. Without exception, their contents, their spent fuel contents, are significantly more than what has been reported in the Fukushima pools. In 2003, my colleagues and I published a study which caused a little bit of stir that pointed out that if terrorists were to attack a nuclear power station, and if they were to cause the pools to drain, a pool to drain, it might lead to a catastrophic radiological fire, and that the land contamination from cesium-137, which has a half-life of 30 years and gives off a form of external penetrating radiation as it decays, and also mimics potassium as it remains in the environment, was a concern. And it was cesium-137 that was the major problem as to why they still have an exclusionary zone around Chernobyl that's roughly the size of half of New Jersey. We pointed out that if a spent fuel fire, at least in taking the nuclear safety literature to its logical extreme, might create land contamination, it would be substantially greater than that. We also recommended that this risk could be greatly reduced by thinning out the pools and using the pools for their original purpose, which was to allow for short-term cooling and to emplace the remainder of the spent fuel that's older than 5 years into dry hardened storage containers, dry casks. This is something that Germany did about 25 years ago because they were experiencing a lot of NATO jet crashes and were having to experience acts of terrorism, not necessarily at their nuclear sites, but at public places and the like. And so they became very concerned and did things that we should now be emulating. The National Academy of Sciences was eventually called in by Congress to sort out the controversy. In 2004, they released a report which the NRC's first tried to prevent it from being made public, but that's the way life is. It was made public, and the report, in very general terms, agreed with some of our central findings, namely that a spent fuel pool fire caused by an act of malice could lead to potentially catastrophic consequences relative to large radiation releases, and that dry storage was definitely a safer way to go. Got one more minute. So we're now in a situation now where we need to revisit this. I think that having spent fuel pools open to the open air now after an accident should be a wake-up call. And I think that we should be looking at ways to to improve the storage of this material. For too long, we've had a policy that has put the nuclear waste disposal cart before the storage horse. The basic reality of the situation is that these very large amounts of radioactive materials that are at these nuclear power generating stations are going to remain there for some indefinite period of time, and so we should make very, very sure that they're there in the safest, most secure manner possible. Thank you very much.
Good morning, everybody. My name is Andy Kanter, and I'm going to talk about something a little bit different. I'm going to be using some graphics about evacuation zones and so on. All of them are actually available both electronically and in our briefing book. If you would like to have some more information afterwards, I'll be happy to provide them to you. The accidents in Chernobyl and Fukushima provide important lessons regarding the danger to public safety and the need for evacuation zones that are appropriate and feasible around nuclear power plants. Radiation from the Fukushima Daiichi reactor has been detected well outside the 20-kilometer zone. The radiation levels you have heard about were despite the fact that the area around Fukushima was apparently spared most of the fallout, as can be seen in these diagrams. Radiation monitoring provided by the Comprehensive Test Ban Treaty Organization and the Austrian government shows that over the first several weeks, the plume has mostly been blown out to sea. Radiation measurements of the soil samples taken as far away as 50 kilometers from the reactor showed levels of cesium-137, which exceed the cutoff used for determining the the long-term evacuation zone around Chernobyl. So the permanent exclusion zone around Chernobyl actually extends for only 30 kilometers, but 5,800 square kilometers is heavily contaminated. And if you'll notice, there's an area about 300 and 400 kilometers away in Belarus that is basically uninhabitable. Hundreds of thousands of square kilometers of forest and agricultural area are off limits or required topsoil decontamination. It is clear that the original evacuation zone around the Fukushima reactors and the current 10-mile evacuation zone that's mandated in the United States are insufficient. We could only postulate what the actual contamination would have been in Japan had the prevailing winds actually not been over the ocean, but rather been over the populated areas. Chairman of the Nuclear Regulatory Commission, Gregory Yatsko, on March 16th, announced a 50-mile evacuation zone for all Americans near the Fukushima plant. Now, the Japanese government did commission an institute to perform a simulation based on the data that was known as of March 16th, and this suggested that there were going to be much higher doses outside their evacuation zone, and that prompted the slightly larger stay indoors zone. Using similar simulation software provided by the U.S. government, PSR did an analysis of what would happen from a nuclear reactor accident near a major metropolitan area. In this case, the Braidwood reactor outside of Chicago. We used these two tools, the HPAC and CAT software. The simulation modeled the loss of coolant accidents similar to Fukushima with exposure of the reactor core, a containment breach, and release of the reactor superheated radioactive fuel into the air. The resulting plume of radioactive materials would extend far north of the reactor itself to the northern edges of metropolitan Chicago, and as you can see from here, east into Indiana and Michigan as well. We estimated that, using the software, that 200,000 people would receive high enough doses to develop radiation sickness, and 20,000 might receive a lethal dose, according to our projections. The acute exposure levels that are shown in this map, slightly different, reveal the intensity of the radioactivity and the risk to the first responders and the size of the area required for evacuation. The area that would be required for evacuation or other protective measures is shown actually in orange on this slide, and it's identified as the EPA PAG, or Population Action Guideline. And as shown in this map, this includes the majority of the city of Chicago, extending east to Gary and South Bend, Indiana. The number of acutely ill people in this scenario would overwhelm all available healthcare facilities. About 113 hospitals actually would fall within the maximum occupational exposure zone, affecting more than 32,000 beds, which most of those are going to be full at any time. Nearly 20,000 physicians in 5 counties would receive the greater than the occupational maximum for radiation exposure from the plume itself. And the first responders, who include the firefighters, would also be injured. 10,500 firefighters in 355 different departments would exceed their occupational exposure level from the plume and would be unavailable to help respond in a highly contaminated area. And it's not just Chicago we're talking about. The Union of Concerned Scientists performed a similar study of a core meltdown at the Indian Point reactor that's located 35 miles north of where I live in New York City. This showed that an even higher death toll would occur and greater destruction than we originally, that we showed for just the Chicago simulation. Millions of people in the greater New York City area would have to be permanently relocated because of the resulting contamination, would leave huge areas uninhabitable for many years or even decades. They postulated that economic losses could be from $500 billion to $200 trillion. Now, one considers all of the nuclear plants in the United States, and including those on the border of Canada. Over 1/3 of the population of this country, over 111 million people, live within 50 miles of a nuclear reactor. So using a new web tool that PSR is releasing today, I was able to demonstrate whether any particular address is within an evacuation zone. And we can do more about this in the question and answer. But here, what I did was superimpose the 50-mile evacuation zone over the Indian Point reactor near my house. And using this tool, we can see that over 17 million people would fall within this evacuation zone. There is no conceivable way that these people could be evacuated in the case of a serious accident at the reactor. The experience from Hurricane Katrina was that even 1 million people, with several days of notice, could not be adequately evacuated. So it is clear that the authorities and healthcare system would not be able to properly protect the health of all the people and vulnerable populations that would need to be moved in the case of a significant reactor accident, let alone the massive number of injured or potentially injured people. And the entire process would likely be a public health disaster. And now I'll turn it over to Ira Helfand, who'll talk again about the radiation issue. Thank you.
Good morning. The nuclear industry really does not want to hear about the huge numbers of people that would need to be evacuated or will need to be evacuated when the next disaster occurs. But from a medical perspective, the measures that Dr. Kanter just described will be necessary to protect human health. Since the beginning of the Fukushima disaster on March 11th, we have been told repeatedly by industry spokesmen and government officials that the radiation discovered in the air, in drinking water, and food is safe, or that it does not pose a threat to public health. Specifically, we've been told repeatedly that 100 millisieverts is a threshold below which there is, quotes, no detectable health effect, end quote. Unfortunately, this is not true. It is the consensus of the medical and scientific community, summarized in the National Research Council's BEER 7 report, that there is no safe level of radiation. Any exposure, including exposure to naturally occurring background radiation, creates an increased risk of cancer. Specifically, the BEER 7 report concluded that a 100 millisievert dose, which we are told is a safe threshold, confers a 1 in 100 risk of getting cancer. Now, that may seem like a relatively small risk for one person, but if 100 people are exposed to this dose, one of them will get cancer. And if 1 million people are exposed to this dose, 10,000 of them will get cancer. And there's no way in the world that this should be considered a safe threshold, that it is okay to expose people to. Besides the fact that there is no safe level of radiation, there are two other aspects of radiation exposure that we need to understand to properly evaluate the risk to public health. First, not all people exposed to radiation are affected the same way. Women are more susceptible to the cancer-causing effects of radiation than men are, and children are much more vulnerable than adults, and fetuses are even more vulnerable. Given this, it is particularly shocking that the Japanese government has decided to raise the permissible amount of radiation that children in the Fukushima prefecture can be exposed to. The new limit that they're proposing, 20 millisieverts a year, corresponds to, in the adult population, to a 1 in 500 risk of cancer. For children, this risk is probably 2 or 3 times greater, meaning that if this policy is in fact put into effect, something like 1 in 200 children will get cancer as a direct result of this exposure. Secondly, radiation from internal emitters, we need to understand, is very different than external beam radiation. If you're standing next to a source of external radiation, like a fuel rod, you are exposed to the radiation as long as you're standing next to the fuel rod, but if you move away, the radiation exposure stops. On the other hand, if you inhale or ingest a particle of radioactive material, that particle will continue to irradiate your body for as long as it remains radioactive and remains in your body. And unfortunately, there are a number of radioactive elements produced in large quantities in nuclear reactors which are biologically active. They are actively taken up by the body and stored in tissue. Iodine-131 is the one which is most familiar to people. It's concentrated in the thyroid, and it causes thyroid cancer. Cesium-137 behaves like potassium. It is absorbed and distributed throughout the body, and because it has a half-life of 30 years, it causes long-term irradiation of the body and causes many different kinds of cancer. Strontium-90 is chemically similar to calcium. It is deposited in bone and remains there with a radioactive half-life of 29 years and a biological half-life of about 30 years. It causes bone cancer and leukemia. Plutonium-239, with a half-life of 24,200 years, is carcinogenic if it's inhaled in microscopic quantities. These long-lived radioisotopes remain dangerous for centuries, and in the case of plutonium, for hundreds of thousands of years. The disaster at Fukushima has been a painful reminder to us all of the imminent and ongoing danger posed by nuclear reactors. The kinds of evacuation planning which Dr. Kanter described a few minutes ago are absolutely essential, and we need to begin to have better plans to evacuate people living around nuclear reactors. But as he made clear, these plans are not going to protect the large numbers of people needed that will be affected, because we simply can't evacuate 17 million people from New York or 5 million people from the Washington-Baltimore area if there's an accident at Calvert Cliffs, or 8 million people from Chicago if there's an accident at Braidwood. Rather, we need to take other measures to prevent this from happening in the first place. And PSR is calling on the United States to adopt the 4 following steps which we believe are necessary to protect the health of our patients. First, we call on the U.S. government to suspend operations at nuclear reactors in the United States whose design is similar to the affected reactors in Japan, and at reactors sited on fault lines until a safety review can be conducted at each of these plants. Secondly, we call on the government to upgrade spent fuel pools and harden on-site fuel storage for all operating reactors along the lines suggested by Dr. Alvarez. Third, we call on the government to implement a moratorium on new nuclear reactor licensing and design certification, and to reject the renewal of any licenses for reject the renewal for any licenses for existing reactors until all the lessons of the Fukushima accident are fully understood. And finally, we call on the government to eliminate the subsidies for new reactors, especially loan guarantees, and to invest instead in clean, renewable energy sources that can meet today's energy needs. The world has suffered 2 level 7 radiation disasters. One at Chernobyl killed tens of thousands of people. The other at Fukushima is ongoing, and we don't know how much radiation will ultimately be released and how extensive the health effects will be. We do not know exactly what form the next great nuclear disaster will take, but we do know that it will happen. If we put enormous quantities of radioactive material in buildings in close proximity to millions of people, the systems which contain these radioactive materials must work perfectly. But we are human, and we are fallible, and the systems which we engineer, however good they are never perfect. We must not wait for a third disaster to take the steps necessary to protect public health. Thank you.
Great. Thanks to the 4 of you. And now we're open for questions. And again, a reminder, if you can come up to the microphone, that way your question will actually be recorded. And you can hand off the microphone. Cool. So that'll make life a little bit easier. Won't go far, but if we covered all, okay, great. And please, direct your question to a particular person.
Thanks.
And you might announce who you are.
I will.
Also.
Okay. Yeah. I'm Renee Scho from McClatchy Newspapers, Washington Bureau. It was mentioned that much of the radioactive material blew over the sea in the early days. Is anything known yet? And I know it's ongoing, the radiation is still being released, but is there any study that shows where some potential dead zones, cesium deposits are in Japan, and how many people might be affected?
Yes, so actually at the Austrian website and also the CTBTO, they will project over from the time of the accident all the way through now in terms of where the radiation has gone. Unfortunately, the measurements that were immediately around the plant were taken out by the tsunami, so we'll never really know what was happening. The hotspots that we currently are seeing northeast of the plant that are outside the evacuation zone in a sort of a long strip were thought to have happened fairly initially during when the wind was blowing over that way for a very short period of time. And then with the addition of the rain that caused these particular areas of higher radiation readings. The information that Dr. Helfand mentioned about the children is particularly concerning because more recent gamma measurements of children's playgrounds, again outside the area, were showing levels that would lead to these higher, and many of them were actually quite higher than the limit that was just mentioned. So that, for example, the cutoff is now 3.8 microsieverts per hour, which when added up creates the 20 millisievert limit, which is something much more closer approximation to what a healthy male nuclear worker might be limited to expose to, not young children. But there were areas as high as 20 to 30 microsieverts an hour from these schoolyards. So there clearly are hotspots. Most of them so far are northeast.
One of the problems we have, I was just going to add to that also, one of the problems we have in dealing with the situation, of course, is that we don't have detailed information, and I think at this point we have to say the information we're getting isn't reliable. In the immediate aftermath of this accident, I was asked repeatedly by various members of the press whether we could trust what we were being told by the Japanese government. And I always said, I think we need to give the Japanese government the benefit of the doubt. They're working under incredibly difficult circumstances. I think we should assume they are telling the truth. We now know that they very deliberately misled the public in the days immediately after the accident and have admitted to that and have said that they did it specifically to minimize the public perception of the severity of the accident. We also know there's just this week been a major revision of the amount of radiation that was released on April 5th from less than 1 terabecquerel to 154 terabecquerels, a huge discrepancy. And I think that we have to be prepared for the fact that we are not getting all of the information that we need to figure out exactly where the radiation is and how severe it is.
And I'd like to just bring this to a individual personal level. When I was in East and West Germany a month after Chernobyl went up, and the mayor of Marburg came up to me and said, what do I tell people? I get different answers from my doctors, from my radiation physicists, from my engineers. I don't know what to tell people. And he said the cows in the county next door are out in the fields eating the grass, and we've kept our cows indoors. And I'm sure there are mayors in Japan who are feeling this same dilemma right now. The other issue is that radiation does not distribute evenly. So we look at these averages that we're talking about here. But you may have, for example, a rainstorm. And so puddles are created where there's high levels of cesium and iodine in the puddle. And I was in a subway here in Washington the other day, and I was watching a father with his little girl in her red boots, and they were walking out of the subway, and there was wet stuff on the pavement, and she's splashing in this. This is what kids do. And so I think when we think about these things, we have to think about this individual personal level. What must it feel like to live in this area and know that now the level the bar has been raised for your children, and it's kind of an unknown, unseen thing. Are my kids out playing in those puddles that have higher levels? And so this is part of the issue that, again, I think we need to keep in mind as we work through this.
Other questions?
Thank you. Matt Wald, New York Times. I'd like to explore a little bit your understanding of Beer 7 and whether, in fact, there's a contradiction between the assumption that there's no safe level of radiation and that there are no observable effects below a certain level. Are those statements, in fact, in contradiction?
Sorry. they in contradiction? I think the phrase that's used is there are no detectable effects. Right. And it's a really disingenuous way of phrasing things. It is very difficult to detect the effects in a given individual for a dose that low. And so I guess you can say that. The phrase tends to imply that there are no effects, and that's a very different thing. Again, if you have a 1 in 100 risk of getting cancer from that dose of radiation, if you look at any one individual, you may detect no impact on that person's health. But if you expose 100 people to that dose, one of them is going to get cancer. Now, that cancer isn't going to have a little flag on it that says, I was caused by cesium-137. It's going to be a cancer. And cancer is a pretty common disease. If you have 100 people, during their lifetime, about 50 of those people are going to get cancer. So the one more cancer that is caused by this radiation is kind of hard to pick up statistically, and it lets you make the statement that you can't detect it. But that person still got cancer because we know how radiation behaves, and if you look at the dosimetry effects, most of this is calculated from the Hiroshima-Nagasaki experience. Some of it is calculated from experimental studies using animals.
But it's calculated, it's not observed, right?
No, it's observed. It was observed at Hiroshima-Nagasaki, and from that the dosimetry was constructed. And if you look at the
doses in that level do produce additional cancers, or it's calculated?
It is observed, but it is very difficult to do that observation if you have very small doses. And if you look at the Bureau report, in coming to that conclusion, they summarize literally thousands of studies of radiation exposure. And I think that no one seriously challenges that conclusion, that there's a linear response of radiation exposure all the way down to zero, and that there is no threshold. And again, there's this sort of disingenuous attempt to use the difficulty in demonstrating the effects to suggest that the effects don't exist. And again, just to go back to that one individual who's got cancer, his cancer is not going to, or her cancer is not going to have a little flag on it. It's going to be hard to show this statistically, but that person's going to get cancer, and they're going to have a 50% chance of dying. They're going to have to go through some very difficult treatment, and we can't just sort of pretend that didn't happen. You know, if radiation events were like Bhopal, it would be a lot easier for us to see. When all the people who were killed at Bhopal died shortly after the exposure, almost directly from it. With radiation, that isn't. There were people. Okay, a large number of people died right after Bhopal. Let me phrase it that way. The death toll from something like Chernobyl is spread out over decades and over huge areas of ground, and it is hard to show it, but that doesn't mean it's not there.
And actually, we got a couple more answers to that question, at least one.
I think it's important as we think about this issue to think about the history of medical radiation. Basically, we have three sources of radiation in our lives. One is the background radiation, which we maybe can affect. If I choose not to fly, I'll have less background radiation, for example. The second is medical radiation. And medical radiation, throughout its history, the trend has been to decrease the dose that we give to people. When I started practice, it was quite routine as I did obstetrics to do pelvimetry on women who came in labor. And this was an x-ray to the pelvis, 2 or 3 x-rays actually, to see whether the baby would fit through the pelvis. It was an absolutely useless procedure, but it exposed infants at the end of the pregnancy to doses of radiation. So Dr. Alice Stewart in England did an elegant study that has since been supported that showed that 1 x-ray to an infant in utero increased that baby's chances of getting leukemia 1.5 to 2 times. And the younger the child is, the more likely there's an effect. There was a study in the Journal of the American Medical Association not long ago that showed that women getting dental x-rays where they had aprons on but not thyroid shields had lower birth weight infants, we think probably from the effect of the radiation to the thyroid gland. And many of these women didn't even know they were pregnant. This was early, very early in their pregnancies. So in medicine then, the trend has been to lower the dose of, quote, safe radiation. And yet we know today there's a lot of discussion about how many CAT scans people get Yeah, I had a woman in the other day with irritable bowel syndrome who'd had a total of 8 CAT scans, and she's in her 30s. Because every time she goes to the hospital, she gets a CAT scan. Well, this is something that she didn't realize was cumulative. So those radiation doses are cumulative. And of course, the third source is the source that we're talking about today, and that is the release from the nuclear power cycle, which goes from the time we dig it out of the ground till we put it into fuel rods, till we run it through the plants, we make nuclear weapons out of it, we test nuclear weapons, to where we put it in the ground and we don't know how to put it in the ground or how to keep it out of the environment for thousands of years. And that's the radiation that we can do something about, and that is being given to the public worldwide without their consent. Again, an experiment that, in my opinion, is unconscionable and needs to be stopped.
Other questions?
Hi, Bill Freeburn from Platts. For Dr. Kanter, just in looking at your simulation for the Braidwood facility in the Chicago area, I'm trying to understand sort of what the parameters were for the release of radiation, and I saw that you had 20,000 fatal exposures, and it sounds like it's a little different from what was happening at Fukushima, where you had 3 reactors and no fatal exposures that we know of right now, right? So how are those things different?
Sure. I mean, I think the simulation that we use and the simulation that the Union of Concerned Scientists used were probably more extreme examples, the loss of coolant leading to full meltdown and breach of containment. However, that doesn't diminish the overall impact on the evacuation zones and the potential impact on the healthcare delivery system within that environment. So it's clear that we don't know what's really going to happen at Fukushima, and there continues to be a large amount of radiation release. The evidence from the simulations or the measurements done by the CTBTO shows that we dodged, or the Japanese dodged, I guess if you could say, dodged a bullet in terms of majority of that radiation going elsewhere. If that had gone back over a highly populated area, then it would be quite analogous to our simulation, and that we're talking about the similar orders of magnitude. Also, we did a simulation about the potential release from a spent fuel pond, which Bob Alvarez just mentioned, where maybe 5 to 10 times the amount of radioactive material are stored, and in a much less contained area. So if there was a fuel fire, we're talking about a similar type of release. So they are different, but the general magnitude is the same, and that the ultimate impacts upon the people and in terms of planning and the healthcare system in terms of evacuation are the same.
Can you say what percentage of the radioactive material in the core was released in your simulation?
In the simulation was the vast majority over a period of 2 weeks. 4%.
Some great questions, actually. Any others before we may wrap? We'll see.
I have a question for my husband, Robert Alvarez. It's been my experience. It's been my experience that the nuclear governments don't always tell the truth to people about radiation dangers. And I understand that there's been an effort by a professional group in Japan to get radiation readings from different school buildings. And I wonder if you could tell people what those findings have been, and just sort of generally.
This past weekend, the Japanese Astronomical Society, I believe it's called. Bear with me here because I wasn't prepared to answer this question. Performed measurements at 1,600 schools, I believe, and mostly outside of the Fukushima prefecture. And I have to bear with me because I was not, I don't have the numbers in front of me and I don't remember them exactly, but the things I do remember is that the dose rates measured at 1 meter above the ground where normally a child would be the most highly exposed. The cumulative dose from the dose rates being measured, again, they didn't reveal the time frame this happened, was on the order of about nearly 1,000 millirem. They also reported soil concentrations, particularly of cesium-137, which in the 40-kilometer zone that exceeded the levels that triggered the evacuation around Chernobyl. That's the extent of my memory about that. I apologize that I'm not prepared to sort of talk about it in greater detail.
Any last questions, or you want to comment on that?
Yeah, sorry, just I don't know how this is not projecting exactly right. This is those measurements that Bob was talking about in terms of the school measurements. The areas, the plant is over here. The areas in orange red are, as you can see, over 15 to 20 micro rem and microsieverts, and all the areas in yellow and light green would exceed the 20 millisievert limit per year.
So we may be ready to wrap up here, but but we're also individuals with families, and we should think about how close we are right now to a nuclear reactor and the evacuation zone of it. And I think Andy's going to type in or click on.
There's actually three ways that you can access this information. If you're in a large metropolitan area, Boston, Chicago, New York, Los Angeles, or Washington, you can just simply click on the button. You can enter an address, and here I entered our address right now, 527 14th Street in Washington, D.C. And what it will do is it'll actually plot where it'll find the closest nuclear reactor. It will plot the evacuation zones and your location associated with it. It's going off to the census data, and it's calculating the number of people in those particular evacuation zones. And then if you want more information about the plant itself, right next to the plant here, it says Calvert Cliffs. You can click on it, and it will open up the NRC page for that particular plant. Sorry, this is the closest one. If you want, you can actually see all of them by doing this, and then you can zoom in on the actual plant itself if you want. But the simulation actually, or sorry, the graph actually picks the nearest nuclear plant to you. So you can see that there actually are three in the area.
Thanks for that helpful reminder. That's reassuring, isn't it? Okay, unless there are more questions, I think we can bring it to a close. Thank you all very much for coming.